So there's a very well-described condition called the genitourinary syndrome of menopause, which describes a constellation of symptoms that result from declining estrogen and its effects on the vulva, the vagina, the urethra, bladder, and the pelvic floor muscles. So those symptoms are vaginal dryness, painful sex, a chronic sensation of irritation, burning, itching, bleeding for some women, tearing, fissuring, and then increased urinary urgency, frequency, frequent UTIs, leaking, incontinence, and just sort of general pelvic floor dysfunction and prolapse. So it is a ton. So many symptoms can develop from this because those tissues are so exquisitely hormonally sensitive. So the main thing that we do for this syndrome is replenish the tissue with estrogen. This is considered a very safe therapy. There is almost no condition that is a contraindication or a reason not to use vaginal estrogen. We don't exercise the same caution that we do when we're talking about systemic hormone therapy, mostly because when it's administered vaginally, it doesn't have really any systemic absorption. And so it's considered safe in breast cancer patients and ovarian cancer patients and heart disease patients, stroke patients, all of these women who really need to pause before we do hormone therapy. Really no reason not to proceed with vaginal therapy, vaginal estrogen therapy. There are other ways that you can treat it if you don't like vaginal estrogen, it makes you uncomfortable, you find it messy. There's lubricants to use for intercourse. There's vaginal moisturizers. You moisturize the tissue the same way you moisturize your face. A lot of these are hyaluronic acid. And then there are other not estrogen-based therapies that are available that you can discuss with your doctor as well.